Ladies and gentlemen, chronic gut disease is really common. People often present with tummy pain, with bowel dysfunction, such as diarrhea or constipation, or both, bloating, difficulty eating, difficulty finishing a normal meal, feeling uncomfortable after eating a normal meal. These are common symptoms in the community. They're often attributed to irritable bowel syndrome or other functional gut disorders. But we've discovered in Newcastle, and others around the world have confirmed these discoveries, we've discovered that in fact, a number of these people who have these chronic unexplained symptoms actually probably have an underlying gut pathology characterized by increases in what are called eosinophils. Eosinophils circulate in the blood. Eosinophils can also accumulate in tissue and cause damage. And the evidence we've accumulated is these cells may be important in some people with irritable bowel syndrome, functional dyspepsia, and other unexplained gut syndromes. And that means we may have some new treatment options in the near future. Eosinophilic gut diseases previously have thought to be really very rare. There are well-described eosinophilic gut diseases that affect the swallowing tube, the esophagus, the stomach and the upper small intestine, and the large bowel. But these diseases, as I said, have really been thought to occur very, very infrequently. But if you look carefully, as we have done, you can identify in a significant proportion of patients with unexplained gut problems the presence of abnormally increased eosinophils. Now, eosinophils in the gut also occur from other causes, for example, from parasites, and we've known this for many, many decades. So obviously, one of the diseases we try to exclude when we see increased eosinophils is the presence of parasites. And parasites may play a role even in some of these unexplained gut disorders, although that's an area of current research. And drugs, medications, can also lead to increased tissue eosinophilia. A number of different drugs have been reported to be important, although most of these drugs only do this very, very occasionally. There are also reports that some drugs may suppress tissue eosinophils, such as the acid blockers, the proton pump inhibitors, like omeprazole or esomeprazole. So it's interesting. Drugs can increase tissue eosinophils in the gut or even potentially reduce them. And so these are factors to consider when you're studying tissue eosinophilia. So in 2007, we published a very important paper showing that in patients with chronic unexplained gut symptoms, including feeling full after you eat, so you can't finish a normal meal, feeling bloated and uncomfortable after you eat, having stomach pain or stomach burning, we showed in these patients where there was no other obvious cause, they had increased eosinophils, these white blood cells that were present abnormally in the upper small intestine. And these findings were very important. These eosinophils appeared to what we call degranulate, the contents of the cells come out of the cell, and those enzymes that come out of the cell are very, very damaging to tissue. And you could show that was occurring close to the nerves present in the small intestine. So this was the first really hard evidence that eosinophils might play a very important role in the diseases that we've previously called functional gut disorders, which have been thought to be caused by other mechanisms such as anxiety or depression. We also showed that these tissue eosinophils increase your risk of developing anxiety. In other words, this inflammation may be very important, not just in the gut manifestations of disease, but also possibly in the psychological manifestations of these diseases. And we've known for well over 100 years that anxiety is a very important component of these unexplained gut disorders. So very exciting to have made this discovery. And we've done further work here in Newcastle, and others around the world have also done work in this, looking at the immune system. The immune system in these patients with these unexplained gut disorders, those with this inflammation, it gets turned on. The immune system is more active than normal. And this also leads to release of cytokines that in turn can affect not just the gut, but also the rest of the body, which may explain why people with these syndromes often have other symptoms like fatigue and headaches and muscle pains. It may well be this is from the inflammatory response in the gut driving these manifestations outside the gut. And this is very exciting because once you understand some of the mechanisms, potentially you can target these mechanisms and actually provide treatments that really lead to relief of the problem. In the United States, recently, we conducted a study looking for evidence of this eosinophilic gut disease. This is the largest multi-centre study that's been done. We found in this study of over 500 patients that there were a very large number of patients with chronic unexplained gut symptoms previously diagnosed as irritable bowel syndrome or one of those conditions like irritable bowel syndrome. We found 45% of them had high eosinophil counts, particularly in the upper small intestine, but also present in the stomach. And so not only were the eosinophils increased, there's another cell called a mast cell that was also increased. They often go together in the tissue. And I think this is really very convincing evidence that our initial observations and the work of others around the world have indeed been correct. There really is, in these chronic unexplained functional gut syndromes, there really is the presence in a significant subset of an eosinophilic gut disease. This is just showing, for those who might be interested, the cell counts in those who had high numbers of eosinophils versus healthy controls. We also had a healthy control group in this study, basically just confirming both in the stomach and also in the upper small intestine, the duodenum, that indeed there was a difference between cases and healthy controls. And indeed, the findings were very similar across the United States from the various centres that enrolled patients in this large multi-centre study. So very exciting data that's just been presented at Digestive Diseases Week this year. There's other information too that's very exciting, and this is really a proof of concept that if you suppress these eosinophils, you get symptom improvement. So there's a new drug that's being developed, a drug that actually destroys the eosinophils in the gut tissue and also inhibits the action of the mast cells in the gut tissue. And this is a drug that's now being tested in patients with eosinophilic gut disorders, some of whom also have functional GI diagnoses, and essentially showing a significant improvement in the symptoms that goes along with the suppression of the eosinophils in the gut tissue. really a proof of concept that suppressing eosinophils really has a benefit for patients. And obviously, we're looking for other drugs and other approaches that can lead to suppression of these tissue eosinophils and hopefully lead even possibly to patient cure of disease. So it's a very exciting time for us in research, but also an exciting time potentially for patients in terms of these eosinophilic gut diseases. We can make a diagnosis of these. We can obviously need to rule out other causes, although they're uncommon, of tissue eosinophilia. And it appears that if we can suppress the eosinophils, we can lead to significant symptom improvement. And this holds out hope for patients with irritable bowel syndrome and other related functional gut disorders. Thank you very much for your attention.